Hello, I'm Marcus Boston. In today's video, we're going to discuss why fetal bradycardia can be dangerous for your baby, especially if it goes on for a considerable amount of time. Now, you may be asking yourself, okay, fetal bradycardia, that's a big word. What are you talking about? Essentially, what I mean is that when your baby's heart rate, it drops into a very low range. And so when you're giving birth, moms, you all know this, they put a device on your stomach and it's printing out information and it's letting the doctors and the nurses have an idea in real time as to how your baby is doing. And that device is called the electronic fetal heart monitor. And it's looking at your baby's heart rate and, some more other stuff it's looking at. But for today's video, we're going to talk about your baby's heart rate. And a normal range is going to be anywhere between about 120 to maybe about, getting up to about 160 beats per minute. That's going to be considered a normal range for a baby. When you start getting that heart rate down below that, you're in the 110s, you're in the 100s and below, and this is going on, that baseline is staying down there for a considerable amount of time, this can suggest that your baby may be no longer tolerating a vaginal delivery, especially when there are other factors. If you've got late decelerations, for example, or there's minimal variability, so if all of these things are going on in conjunction with fetal bradycardia, this may be enough to alert the doctors and the nurses that this strip is no longer what we call reassuring. It's now moved into a non-reassuring aspect of the strip. And so these things are really important for doctors and nurses to be on the lookout for. Now, what can cause fetal bradycardia? There's some things that can cause it. If there is going to be a compression of the umbilical cord, this can cause a sudden drop in your baby's heart rate. And so like I said, when the doctors and the nurses, they see this drop and it's staying there, they've got to move. They've got to either flip mom, turn mom, or give her oxygen or a bolus, or there's things that they can do to help mom out. But if these conservative measures are no longer working, they have to be ready to move to another step, maybe an emergency C-section if needed. So the purpose of today's video is to just help you understand why understanding your baby's heart rate during labor and delivery is important, and why fetal bradycardia, if it goes on for too long, it can be very problematic because it can lead to a restriction. If there's a restriction in blood and oxygen that is causing the bradycardia, then that can lead to a brain injury, and that brain injury could possibly be HIE, hypoxic ischemic encephalopathy. So I know I talked about a lot in today's video, but I just wanted to help you understand more about this fetal bradycardia and your baby's heart rate. If you have more questions, maybe you're here today, you're watching because your baby has a brain injury, maybe you do have an HIE diagnosis and you have questions. There is a telephone number on the screen. What I invite you to do, go ahead and pick up the phone and call me. I speak with families like yours all the time about these issues. This is what we do. One more thing before I go. I practice law here in the state of Maryland. And if you are not in Maryland and you are watching the video and you want to contact me and you've got questions, just understand that if you're not in Maryland, I have to use what we call co-counsel or local counsel. In other words, an attorney in your state. And that's something that we can assist with, but I just want to make sure that you understand that co-counsel aspect of things. All right, that's going to be it for today's quick educational video. Again, I'm Marcus Boston, and I'm one of the childbirth injury and medical malpractice attorneys practicing law here in the state of Maryland at Boston Law Group, LLC. And we'll see you next time. Take care and enjoy the rest of your day.